If you're over 60 and take any of these 6 medications, pay close attention right now. In decades working in the ER and cardiac ICU, I've lost count of how many patients came in with a massive heart attack after taking one of these medications the night before. The worst part, they were almost always prescribed by a doctor. Today, I'm going to show you who these villains are and how to protect your heart before it's too late. And one of the last ones on this list is going to shock you. It's a pill sitting in the medicine cabinet of almost every adult over 60. Could it be in yours? But first, hit the like button, subscribe to this channel so you don't miss any of our health tips, and turn on the notification bell. And please spread this knowledge with your friends and family by sharing. You could literally save the life of someone you love, so share it right now. And let me know in the comments. Have you ever had a heart attack? Did you suspect a medication might have caused it? Which one? And where in the world are you watching from? Write it below. Every comment get read. Now, an important warning before we begin. This video does not replace your doctor's advice. Do not stop any treatment on your own. Bring this information to your physician and have the conversation. Are we clear? Good. Grab a pen and paper. Let's go through these 6 hidden villains one by one. Villain number 6, decongestants. Villain number 6, you've probably used this one plenty of times. Decongestants, the hidden enemy inside your cold medicine. You know the scenario. You have the flu of the century. Your nose is cemented shut and you can't breathe. You run to the pharmacy and grab Sudafed, Dayquil, or Afrin. In 20 minutes, it feels like a miracle. You can take a deep breath again. But here's what no one tells you. Drugs like pseudoephedrine and phenylephrine don't just act on your nose. They act like a clamp that squeezes the blood vessels in your entire body, and including the arteries that feed your heart. They release noradrenaline, the stress hormone. Your heart starts beating faster, trying to push blood through pipes that just became stiff and narrow. If you're over 60 and already have some plaque buildup, this pressure can cause a spasm. The artery closes up and won't open on its own. That is a heart attack you bought yourself at the pharmacy counter. One study showed that these medications double the chance of having a heart attack or a stroke in the hours following their use. And the worst part? In 2023, the FDA concluded that oral phenylephrine, which is in almost all cold medicines, is completely ineffective. In other words, you are accepting the risk of a heart attack for a benefit that doesn't even exist. Is that a trade worth making? What should you do instead? Saline rinses, a humidifier. If things get really bad, use loratadine, Claritin, which is far safer for your heart. Don't trade your life for 20 minutes of an unblocked nose. Villain number 5, NSAID, anti-inflammatories. And here is another trap. Older patients often take cold medicine alongside this next one. You know the drill. You wake up with a headache and reach for ibuprofen or Excedrin. Back pain, Aleve, Voltaren, Akimotrin. Seems completely normal, right? After all, these are among the best-selling drugs on the planet, but what happens inside your body when you swallow that pill is terrifying. Imagine that your arteries have a private bodyguard called prostacyclin. Its job is to keep your blood pathways open and prevent platelets from sticking together and forming a clot. When you take ibuprofen, diclofenac, or naproxen, you block an enzyme called COX-2, and you fire that bodyguard. Without it, your body goes into a triple collapse. First, the vessels tighten and your blood pressure skyrockets. Second, the blood turns sticky. Platelets clump together and form clots. Third, the heart gets overloaded. Your kidneys stop filtering properly, holding onto water and sodium. Your heart starts working with an absurd force just to keep up. In short, narrow vessels, clots, and an exhausted heart. The perfect storm for a heart attack. And I'm not just saying this to scare you. In 2015, the FDA reinforced their official warning. The risk of a heart attack can start in the very first weeks of use, even in people who have never had heart problems in their lives. Look at the numbers from studies by the Mayo Clinic and JAMA. Diclofenac, often sold as Voltaren, increases the risk of a cardiac event by 70%. Ibuprofen in high doses more than doubles your chance of having a heart attack. But there are life-saving exceptions. Low-dose aspirin, baby aspirin Staug, does the exact opposite. It protects you. And acetaminophen, Tylenol, which is a pain reliever and not an anti-inflammatory, is also a much safer option for your heart. So if the pain hits, don't play dice with your life. Sucks. Talk to your doctor about the safer alternatives. We are halfway through this list, and I hope you are already thinking differently about what's in your medicine cabinet. If this video is giving you valuable information, hit the like button right now. It genuinely helps this reach more people who need it. And if you want me to make a follow-up video on the 6 medications that actually protect your heart, medications the Cleveland Clinic recommends, write the word protectors in the comments below. If enough of you ask for it, I will record it. Now let's keep going, because the next one is the one that surprises everyone. Villain number 4, omeprazole and proton pump inhibitors, PPIs. This is the medication I warned you would shock you. Omeprazole, pantoprazole, Nexium. These famous stomach protectors are in the bags of 70% of people over 60. Everyone thinks they are completely safe, like drinking water, except science discovered something that most people have never been told. PP is don't just act on the stomach, they attack the cells that line your blood vessels. You know nitric oxide, the gas that keeps your arteries relaxed and youthful? These drugs crush its production. Without it, your vessels become stiff and inflamed, and atherosclerosis speeds up. A Stanford study involving almost 3 million patients showed that those who use omeprazole and its cousins have up to a 21% higher risk of heart attack. This even showed up in healthy young adults. Another study showed that chronic use can double the risk of a cardiovascular death. Now, here's the important distinction. I'm talking about people who take these medications for months or years without stopping. If it is short-term use, say 7 days for acute gastritis, don't panic. The danger is the blind, endless use that nobody questions. If you have been on a PPI for years, it is time to have a conversation with your doctor about whether you still need it. Villain number 3, stimulants for ADHD, focus, and weight loss. Let's leave the stomach now and talk about the trending villain. Adults in their 60s are increasingly taking this one to perform better at work. You can probably guess what it is. Ritalin, Vivance, Concerta. What used to be prescribed for hyperactive children has become popular among adults seeking total focus. Studying for an exam, Vyvanse, need to push through a long day, Ritalin. The problem is these drugs flood your blood with adrenaline. Your heart beats significantly faster. Your vessels constrict. Your blood pressure spikes. A 2023 Swedish study tracked 278,000 people and revealed that 5 years of use increases the risk of cardiovascular disease by up to 27% to Dopchout. And the risk of hypertension jumps to a terrifying 80%. And for those over 66, the risk of hospitalization for a cardiac event rises 40% in just the first 30 days of use. And be careful with natural products too. Many weight loss pills and pre-workout supplements from supplement stores hide dangerous stimulants that the FDA never approved, or has already banned. Just because something is sold over the counter does not mean it is safe for your heart. Villain number 2, corticosteroids, prednisone, Decadron, the famous cortisone shots. Oh, you know that shoulder pain that disappears in 2 hours with an injection? Feels like a miracle, right? Except that steroid attacks your heart through 4 factors simultaneously. It retains sodium, so your pressure goes up. It spikes your glucose, it ruins your cholesterol profile, and it thickens your blood, promoting clots. A study published in PLOS Medicine showed that doses of prednisone above 7.5 milligrams a day, used for a prolonged period, double your cardiovascular risk. And here's a trap that catches most people off guard. A patient gets a cortisone injection and thinks it was just a little prick, barely anything. In reality, that one injection is equivalent to taking oral pills for almost a month, silently overloading the heart in ways that don't show up until the damage is done. If you are receiving cortisone injections regularly, make sure your doctor is tracking your cardiovascular risk alongside that treatment. These 2 conversations need to happen in the same room. Before we get to villain number 1, you're the most controversial one on this entire list. I want to ask you something directly. Are you currently taking any of the medications I've mentioned so far? Drop a comment below. Every comment get read. And right now, before you forget, share this video with someone over 60 in your life. A parent, a sibling, a close friend. The share button is right there. Use it. What you share today could protect someone's heart tomorrow. Now, let's finish with the big one. Villain number 1, testosterone injections, pellets, hormone chips, and gels. And now, the last one, the most controversial. The so-called elixir of youth that has become a craze among men over 50 and women in menopause. And that can become Russian roulette if used the wrong way. Testosterone injections, pellets, hormone chips, gels, Clinics have been exploding with prescriptions for these. Many men are using testosterone without even a proven deficiency. My testosterone was at 500, doc, so I had to take it, right? Was it really that low? You should not have taken it. In 2014, a study of 55,000 men showed that in the first 90 days, the risk of a cardiovascular event increased by 36%. In men over 65, that risk doubled. And when it doesn't cause a heart attack, it can cause a stroke. I had a patient, super healthy, passed his full checkup perfectly, who had a stroke and ended up in a wheelchair, all after taking a testosterone injection. Okay, so just one day after the injection. Why does this happen? Because testosterone can make your blood as thick as honey, and thick blood clogs things up. And I already know what some of you are thinking. But Dr. Volker, I only use the gel. It's not that strong. Don't fall for that. A study published in JAMA showed that testosterone gel significantly increases the volume of non-calcified soft plaques inside your coronary arteries. Those are the most dangerous plaques, the ones that look soft but can rupture at any moment and cause a massive, sudden heart attack. Now, there is a gray area I want to be fair about. A 2023 study called the TRAVERSE trial showed that in highly selected and closely monitored patients, testosterone can be used more safely. And I want you to hear that word, highly selected. The danger is not the carefully monitored patient with a proven deficiency working with a thorough physician. The danger is the clinic run by someone prescribing it to almost anyone who walks through the door. Without baseline testing, without monitoring blood levels, without a full picture of the patient's cardiovascular history. I have seen testosterone prescribed to women who had breast cancer simply because they lacked muscle mass. Their oncologist was practically pulling their hair out in frustration. That is not medicine. That is negligence dressed up in a lab coat. My position is clear. I am against the use of exogenous testosterone. Testosterone your body doesn't naturally produce, except in extremely selected cases with proven deficiency and constant monitoring. Period. So let's bring it all together. The 6 villains, NSAIDs and anti-inflammatories, decongestants, omeprazole, and PP is ADHD stimulants, corticosteroids, and improperly prescribed testosterone. My request to you is simple. Do not stop anything on your own. Take this information, bring it to your trusted doctor, and ask one question. Do I really need this? And is there something safer for my heart? That single question has the power to save a life. It might save yours. And if you want to know what actually protects your heart, the 6 medications the Cleveland Clinic recommends to armor your cardiovascular system, write the word protectors in the comments below. If I see enough of you asking for it, I will record that video next. If this video gave you something valuable today, please do 3 things right now. Hit the like button. Subscribe to this channel if you haven't already and turn on the bell notification. I release new videos every week covering the health topics that could genuinely protect you and the people you love. And share this video. Share it on Facebook, text it to your siblings, send it directly to your parents. Information like this only protects people if it reaches them, and you have the power to make that happen right now. My name is Dr. Adrian Volker. I'll see you in the next video. Take care of your heart. It is the only one you have.